The House Health Reform Bill will cost $1,050 billion. It includes the public option. I'm all for it, says Congressman Joe Sestak, with me now from Philadelphia. Congressman, always a pleasure to have you with us.
Good to be here, Stuart.
Let me just make a position point of my own, if I may. I would suggest to you that it is irresponsible, financially irresponsible, to add debt, raise taxes, and come on with fake promises of Medicare cuts. In short, Congressman, we can't afford this. Make your case, if you will.
Absolutely. We don't add anything to the debt. You know, different than the Republicans, where they gave that $1.7 trillion tax cut to the very rich and put it on our national credit card, we don't add to the debt.
Look,
but what we do is this.
I'm sorry, Congressman, look, you will add to it. We're being asked to believe that Congress will cut $500 billion out of Medicare. That's how you get to no deficit increase. That's not going to happen. You know that's not going to happen. And Congressman, which government entitlement program ever costs what you say it's going to cost? It always costs more.
As you know, this is not an entitlement program. What it actually does is say, you insurance companies who are presently making life and death decisions that are presently between the doctor and the patient, to where you forbid coverage for those with pre-existing conditions, to where you worry about your profits, we understand that, but that in 94% of all the health markets in America, health insurance markets, the Department of Justice says by their criteria, they are non-competitive markets. We say there's going to be a public option that you can choose to join or not, and is going to begin to give us more fair competition. Now, let's talk about Medicare.
But it's not.
When we say a Medicare...
Congressman,
here's what we say.
You've not answered the question. Even the Congressional Budget Office itself says it's $1,050 billion for the House bill, which includes the public option. Now, you can't...
But it doesn't add to the debt.
That's assuming that we get $500 billion cut from Medicare. That makes that assumption, which I don't think you can make, quite frankly, sir. And it assumes...
Then let's talk about Medicare.
When can you ever trust the statement about a government program that's going to cost X, Y, Z? Every single time, it costs way more than X, Y, Z. We all know this.
Let's talk about Medicare. As you know, in 2003, the Republican-controlled Congress passed a bill that said if you're a Medicare patient, you can go into a private health care plan called Medicare Advantage. The private company said it would cost the same as Medicare or less, but we give them the same benefits. Today, those companies are getting $160 billion extra because they cost 14% more than government-run Medicare. So what we say is, wait a moment, Mr. Smith, you're in Medicare, and we're paying $1. Mrs. Smith, you're in Medicare Advantage, we're paying $1.16. No, both get the same benefits. So we accrue $160 billion in fairness in order to help begin address, which the Republicans never did the last 8 years, as they doubled our debt from $4.5 trillion to almost $10 trillion. We actually do it with not adding anything to the debt. Second, we also have to recognize doing nothing's not an option.
The option is not. The other option is not to do nothing. The other option would be, if I may say, it would be real competition amongst insurance companies on a national scale. It will be real reduction in state mandates, which are part of the cost anyway, and it will be real tort reform. The opposite of what you're suggesting is not nothing. The opposite is a very intelligent plan, which really would get the cost of health care down.
Well, let's take a couple of your quick points, and I'll be quick. We create a national health insurance exchange, of which one of the many options that private companies can also put in there is the public option. They are national pools. People tend to miss that. They spread the risk. Second, I'm not opposed, as you suggest, to breaking down state barriers. But remember this. When we did that for credit cards in 1975, all the credit card companies domiciled their headquarters in South Dakota because they didn't have usury laws, and the credit card shut up. There's 9 states that don't have the right of appeal. There are many states that don't have minimum benefits. We'll have a race to the bottom because headquarters of the health insurance companies will go to Alabama, where you can't have the right of appeal, for example. And so therefore, you have to have a national minimum level of benefits if you do what you propose, which is another alternative method.
We're flat out of time, but we respect your opinion. You're a former 3-star admiral. We like that, and we thank you again for joining us, sir. Thanks so much, Joe Sestak.
Thanks, Stuart, for having me.
All right.